to connect and join this session. Welcome everyone, and thank you very much for joining us today. My name is Sebastián García Saizo. Welcome to this regional webinar. I'm the director of the Department of Evidence and Intelligence for Action in Health. It is a pleasure to be hosting this event today and welcoming all of the 183 Paho WHO collaborating centers in 16 countries. On this day, we celebrate an important moment. After 20 years, we are resuming these regional events, bringing all collaborating centers in the Americas, as well as our Paho and WHO staff together for a dedicated 2-day session to discuss and make our collaboration even closer. Permítanme recordarles en este momento que tenemos traducción simultánea al español, portugués e inglés para este evento. Encontrarán esta función en el icono redondo que se encuentra en la parte inferior derecha de su pantalla con el título Interpretación. Allow me to remind you all that we have simultaneous interpretation in 3 languages, Spanish, Portuguese, and English. You will find this function in the round icon at the bottom right of your screen, labeled Interpretation. We are happy to inform you that at this moment, we have over 230 participants connected to this session. And for this reason, the mics and webcams have been disabled. Kindly use the chat exclusively to report logistic issues, as our team will be monitoring it constantly. Questions and comments to our moderators and panelists are to be placed in the question and answer module, also available at the bottom of the screen. Finally, let me signal that although this pandemic is teaching us all, without a doubt, on how to use the technologies in many of our daily activities and ultimately shaping the digital transformation in our organizations, we also always need to find solutions and solidarity to face technicalities. Our gratitude this morning to our PWR in Cuba, Dr. Jose Moya and his team, who opened the country office to receive the collaborating centers so they can participate in this webinar. Of course, respecting all COVID-19 protocols regarding social distancing. I thank our director, Dr. Carissa Etienne, for being with us today, as well as our deputy director, Mrs. Lu Valdez, and assistant director, Dr. Jarbas Barbosa. Members of the EXM and my colleague directors, thank you all for being here and for the constant work alongside collaborating centers. Without further ado, please allow me to invite Dr. Carissa Etienne, director of the Pan American Health Organization and Regional Office of WHO in the Americas, to share with us her opening remarks. The floor is you, Madam Director, and once again, thank you very much for being here with us this morning.
Thank you so much, Sebastian, and thank you for your efforts to organize this webinar. So, representatives of our collaborating centers, representatives of national governments, ministries of health, our executive management, colleagues and friends, a very good morning to you. Let me begin by making my compliments to our Paho WHO collaborating centers representatives who are attending this webinar, as well as our distinguished panelists and colleagues from Paho, WHO headquarters, and regional offices. Thank you for joining us today and tomorrow. This meeting is held as a continuum to the meeting which took place in December last year, 2020, when Dr. Tedros, Director General of WHO, led the global meeting of the collaborating centers. Currently, 183 collaborating centers are located in 16 countries or territories of our region. I would also like to recognize the national authorities from these countries who have supported the organization to identify key institutions that can work with us to address challenges that persist in our region. Working together, we can find the best and innovative solutions to achieve the mandates which you member states have set in our Strategic Plan 2020-25, our SHA 2030, and of course, the Sustainable Development Goals, particularly goal number 3. More specifically, let me recognize the remarkable work of the collaborating centers in contributing to Paho and WHO mandates, our strategies and priorities, which have a very real impact in our region, but also worldwide. Since the launch of the Sustainable Development Goals, Paho has made great efforts to work with member states and partners in the implementation of the 2030 Agenda, particularly goal number 3. Paho has actively engaged in this new cycle of global commitment to sustainable development, collaborating with countries in policy formulation, plan development, and implementation, as well as in fostering and ensuring that cross-cutting themes of gender, ethnicity, human rights, and equity are reflected in all of Paho's activities. Paho, in its almost 120 years of a successful history, has been committed to the principles of effective collaboration, partnerships, network building, and evidence-based action. You collaborating centers support WHO and our regional office in fulfilling these mandates, and you are an invaluable asset in generating training materials, conducting research, providing technical expertise, knowledge sharing, and lessons learned. You contribute to the scientific advancement in our region, and we are grateful for this. As you know, COVID-19 has proven to be one of the most challenging public health issues in this century, reaching all countries with no exception. But with daily examples of solidarity, commitment, cooperation, and what we refer to as Pan-Americanism, we are all fighting together, and we have become more united than ever. The region of the Americas has been very impacted by the pandemic, resulting in what we refer to as a triple crisis, a crisis of health, the economy, and social. And we've been advised to add a fourth, which is political crisis as well. The region has been disproportionately affected, both in the number of cases and deaths, and certainly in the economic effects of the pandemic. In fact, more than half of all global deaths reported over the last week were found in the Americas, a sober reminder of the human toll of this pandemic. I say this because more than ever, the alliances between the health sector, international organizations, the scientific community, academia, civil society, and the private sector have proven to be the right way to respond to the threats and challenges of this modern age, as all of us have an important role to play. And we must work to bringing all of our actors together in a coordinated effort. Proof of this is the solidarity that has been shown across the globe through triangular and intercontinental technical cooperation. It is through the relentless and joint work performed by research institutions, ministries of health, academia, and international agencies who have jointly engaged in developing guidelines, sharing studies, and evidence. And it is because of this that we as a global community have been able to respond to this unprecedented health challenge, including the development and the administration of vaccines. And I think that this is testimony to this great alliance. A total of 49 countries and territories in our region have introduced COVID-19 vaccines, and administered more than 247 million COVID-19 vaccines thus far. The Paho Revolving Fund is a purchasing mechanism for the COVAX facility for the region of the Americas, which aims to ensure equity in access to vaccines. But of course, you know that story is still emerging, and certainly that COVAX is facing serious questions in terms of equity of access brought about by production issues, but also vaccine nationalism. What I do know is that we must stop this pandemic that has so affected our lives, reverse the gains that we had previously made, and we must recover our momentum for the accomplishment of the SDGs. So today, let me invite you to hear from our senior management what those frameworks are and the linkages to the SDGs. And let us also, please, let us hear from you as far as your own responses to those frameworks and to the achievement of the SDGs. Paho's strategic plan will enable the region to become more sustainable, just, and equitable, and for its people to achieve a higher level of health. But we require your input and your collaboration to help not just Paho, but all member states in achieving those goals. I am very confident that this webinar, in addition to the daily interactions that you already have with many of our Paho staff, who serve as responsible officers and technical counterparts, I'm sure that this can be fruitful and create many other opportunities to enrich our dialogue. So I hope that this webinar can be one more proof of our appreciation for your immense contribution as Paho WHO collaborating centers. Thank you for being here. Thank you for collaborating with us, and thank you for sharing from your vast knowledge and experience. Thank you very much. Over.
Thank you, Dr. Tian, for your very eloquent and comprehensive remarks, which give us plenty of elements to bring into the discussion today and tomorrow, and a clear perspective on the enlightenment sought for all the work that we carry out together. Now I'm inviting Mrs. Eliane Pereira dos Santos, Advisor on Knowledge Management and Networks from the Department of Evidence and Intelligence for Action in Health, EIH, who will provide us a brief context on the collaborating centers and the perspective for this regional meeting. Eliane will also be from this point our facilitator, so thank you, Eliane, and over to you.
Muchas gracias, Dr. Garcia. Good morning, everyone. Buen día a todos. Soy Eliane Santos, como bien dijo el doctor García, y también, además de mis funciones aquí en la OPS, soy el punto focal regional de los centros colaboradores junto con mi colega Sandra Weinger. Hemos preparado muy rápidamente una introducción, un marco que nos va a poner el contexto de nuestro evento hoy y también mañana, y simplemente decir que los centros colaboradores son partes de instituciones como institutos de salud, ministerios de salud, universidades que tienen una expertise particular y que ayudan con que la organización, la OPS y la OMS, la Organización Mundial de Salud, también puedan desarrollar y desempeñar sus funciones en el marco estratégico y cumplir con esto sus mandatos y estrategias.
Eliane, sorry to interrupt. Maybe you can change the format on your screen sharing, because we're looking at the presenter mode, so the slides are very small.
Okay.
Maybe if you can change that and go into full screen mode for the presentation.
Let me just. Thank you for that. Better now?
We're not seeing it yet.
Better now?
Still not coming up.
Let me choose this one.
So the instruction is to stop sharing.
Yeah,
Start
I
sharing.
did it. Let me see here. Recording. Yeah,
You should go now to share your screen only.
I'm gonna share my entire screen too, which is this one. And I'm sorry about that. My apologies. We prepared a lot for this moment, but it happens. My apologies on this regard. Is better now?
We're not seeing it, Eliani. Sorry.
I really don't know what is going on. Share screen. Let me share this screen here. Share. Now?
Yes.
Perfect.
Thank you very much. Thank you. So, as I was saying, los centros colaboradores son parte importante de nuestra institución, de nuestra organización, y nos apoyan con el logro, el alcance de los mandatos y estrategias de la organización. Los centros que están ubicados en nuestra región se acostumbran ser denominados como centros colaboradores de la OPS-OMS, una vez que la organización también tiene ahí su marco de ser oficina regional de la OMS para las Américas. Muy rápidamente, como mencionó la doctora Etienne y también el doctor García, aquí están los 16 países, territorios y el cuantitativo, la cantidad de centros colaboradores por país, simplesmente para criar este contexto, que é uma família de 183 entidades e instituições que nos ajudam em nosso labor. O objetivo deste webinar, creio que já está muito claro, que é, primeiramente, apresentar e compartilhar com todos vocês, desde nossa gerência executiva, de los diretores de departamento e painelistas invitados, uma primeira mirada, uma primeira perspectiva de quais são as estratégias regionais, em nosso marco de las prioridades regionais e como os centros colaboradores estão trabalhando mano a mano com a organização. Queremos também, com isto, prover uma oportunidade de garantizar espaços mais interativos, mais colaboradores com as instituições, onde hemos também preparado uma exibição, uma exposição de pósteres que foram enviados por nossos centros colaboradores e que, na sequência, les vamos invitar a que visitem e que votem em los pósteres que les gustem mais. Isto também para que os centros puedan estar registrados, documentados neste webinar e, además, cada centro nos enviou recomendações de como podemos melhorar ainda mais este mecanismo e como os centros podem ajudar a com que cumplamos e alcancemos juntos os objetivos do desenvolvimento sustentável, a Agenda 2030. Também reconhecer o próprio mecanismo de los centros colaboradores como uma contribuição em si do cumprimento de los SDGs, uma vez que estão aí instrumentos, iniciativas de la cooperação internacional, de la cooperação sur-sur e de outros mecanismos de integração e solidariedade entre países. Antes de dar seguimento ao webinar, permita-me, por favor, fazer uma breve explicação de como e de los passos que hemos trabalhado hasta llegar a este webinar. Em 2017, se apresenta um documento de informação durante os corpos diretivos da organização, onde apresentamos as evidências de como a organização vem trabalhando com os centros, sua importância, dando visibilidade e criando os primeiros enlaces de como os centros, además de apoiar a organização, também alcançam os objetivos globais como os ODS. en el 2019 en preparación para el nuevo plan estratégico de la organización de 5 años 2020-2025. Hacemos una encuesta interna con los responsables técnicos que llevan los centros colaboradores, donde hemos con un par de encuestas, entrevistas y otros elementos de estudio, hemos identificado que básicamente en qué áreas, en qué partes de la agenda y qué tipo de actividad los centros más desarrollaban. Esto para entender las potencialidades y también conocer todavía las brechas y generar oportunidades de que con los centros podamos tener también una variedad más amplia de trabajo con los centros colaboradores. En este estudio, en 2019, hemos entendido que 77% de los centros ayudan la organización con la organización y la realización de actividades de capacitación, enseñanza, creación de capacidades, seguido de generación de conocimiento científico técnico, varias publicaciones, capítulos de publicaciones, artículos científicos, son generados con la colaboración de nuestros centros colaboradores y luego también colección de información, de datos, generación de servicios web, de sistemas de información, bases de datos, plataformas y luego también proyectos de investigación. Ahí está una evidencia de que básicamente casi 50% de los centros colaboradores nos ayudan con al menos de 1 a 5 actividades respectivas a capacitación, educación y a generación de capacidades en varias áreas, en varios temas que lleva a la organización. En este marco también, casi 50% de los centros nos ayudan con la producción de conocimiento científico técnico, como mencionado. Gran parte de la literatura que genera la organización tiene el expertise, el apoyo de nuestros centros colaboradores. También nos ayudan con proyectos de investigación, sin embargo, también hay una oportunidad para que estos mismos centros nos ayuden más, trayendo innovación y trayendo formas de mejorar las metodologías y aplicación de investigación en lo que se requiere para que la organización pueda cumplir sus mandatos. Entonces, fue para identificar las potencialidades y también identificar las brechas y donde podemos buscar más ayuda y colaboración de los centros. Luego de esta encuesta, que también se va a contribuir con la evaluación que está haciendo la OMS, la Organización Mundial de Salud. Esto nos va a contar un poco el doctor Barbosa en su intervención. Con este material, el documento de información y también con el estudio, hemos internamente desarrollado un par de herramientas de implementación donde los planes de trabajo, el proceso de designación y redesignación estén cada vez más alineados con el plan estratégico, con los objetivos de los SDGs y con toda este conjunto de prioridades de la región para que los centros colaboradores nos apoyen cada vez más en estos mandatos y en estas prioridades. Hemos generado varios mecanismos de mejorar y fortalecer la visibilidad a los centros colaboradores, como newsletters, videos, spotlights, inclusive un spotlight específico donde distribuimos los centros a partir de las metas de los ODS, también trayendo esta perspectiva. Y en este año presentamos un nuevo documento de información a los cuerpos directivos y una de las recomendaciones fue retomar y restablecer un contacto regional con todos los centros colaboradores reunidos y también con los funcionarios de la organización, que se materializa entonces por este webinar. Hoy por la mañana, a la secuencia, tenemos 3 paineles donde ustedes van a conocer la gerencia ejecutiva, los directores de cada departamento técnico, bem como nuestros directores y otros painelistas invitados de la organización, que nos van a comentar sobre las prioridades de la región, nos van a dar una perspectiva de cómo la organización está tratando de monitorear, de buscar los elementos que nos dé las evidencias de cómo la región está alcanzando los objetivos de los ODS, y bien como también cómo posicionamos el mecanismo de cooperación técnica, el panamericanismo, en el painel 3, donde vamos a escuchar también una evidencia de cómo la organización, con ayuda de los centros colaboradores, está trabajando en la respuesta al COVID. Mañana, em um espaço mais interativo, com mais discussão, mais interação entre funcionários da OPS e os centros colaboradores, vamos ter sessões paralelas, lideradas por cada departamento técnico, e por la tarde hacemos um recorrido de los principais elementos discutidos durante estos dias, e vamos fazer também um reconhecimento a todos los centros colaboradores que han enviado, sometido sus pósteres. Me gustaría aquí en este momento agradecer a los 46 centros colaboradores que nos enviaron sus pósters. Esto nos va a dar material para identificar los entregables, los deliverables de cada centro colaborador en el marco de su plan de trabajo, bien como también cada centro fue invitado en este póster brindarnos recomendaciones de cómo podemos fortalecer la gestión de los centros, el intercambio con los centros, y también de cómo podemos juntos alcanzar los objetivos de la Agenda 2030. Más una vez, muchísimas gracias por esto. Terminada entonces esta parte de introducción, me gustaría ahora invitar al doctor Jarbas Barbosa da Silva Jr., para que pueda entonces empezar el painel 1, el painel técnico, donde también vamos a tener el honor de recibir los directores de departamento. Doctor Barbosa, muchísimas gracias por estar aquí con nosotros. You have the floor. Thank you very much.
Thank you. Thank you, Eliane. Good morning again. I want to welcome everybody that's participating in this very important meeting, our collaborating centers and our Paho WHO staff. During this panel, we will present the technical cooperation and the priorities of the region. I will begin with the results of the internal evaluation done by Paho in 2019, and refer to Dr. Etienne's comment on the evaluation coordinated by WHO in 2020. As we have seen, Paho's study in 2019 sought to bring more visibility to the work of the collaborating centers and to demonstrate how this collaboration is contributing to the achievement of the organization's plans, mandates, and programs, and ultimately to its priorities and mandates. Much of Paho's work in areas such as training, education, capacity building activities, technical advice, publication of technical literature, data and information collection, provided laboratory services, standardization of terminologies, and laboratory activities have been supported by or provided by our collaborating centers. In turn, the evaluation of WHO's work with collaborating centers examines the relevance, effectiveness, and efficiency of the programmatic contribution of the centers to the achievement of WHO objectives and expected results. The evaluation documented the success, challenges, and best practices, and provided the lessons learned and recommendations for the management to use in future policy and decision-making. The evaluation resulted in 5 recommendations to guide the work of the organization to streamline partnerships with the collaborating centers. The first one is to develop, implement, and disseminate a strategic framework for working with the collaborating centers. Second, to promote awareness of collaborating centers and their contribution both within WHO and with external audience as appropriate. Third, develop a communication plan for the organization's relation with collaborating centers. 4, use the forthcoming redevelopment of the electronic collaborating centers as an opportunity to improve the effectiveness and efficiency of the online system. And finally, undertake a review of current staff support and management systems. I'm happy to inform you that Paho is responding to and implementing initiatives in relation to all of them. However, and for the purpose of this panel, I emphasize the first recommendation: develop, implement, and disseminate a strategic framework which underlines the continuous alignment of the priorities of the organization as they respond to the priorities of the region and the global agenda. Paho's Strategic Plan 2020-2025 is a product of the collective efforts developed in close consultation with member states to respond to these regional priorities and perspectives, which are also expressed in the Sustainable Health Agenda for the Americas 2018-2030, SHA 2030. The strategic plan identifies specific actions to tackle health inequality. 4 cross-cutting themes are central to this plan's approach to addressing the determinants of health: equity, gender, ethnicity, and human rights. In addition to highlighting an integrated multisectoral approach, this plan applies evidence-based public health strategy, such as health promotion, primary healthcare approach, and social protection in health to address the social determinants. Paho member states have clearly stated that the strategic plan is a crucial instrument for implementation of SHA 2030, which I invite you all to read and use as a reference document along with the strategic plan. Both documents are available from our website, but our colleagues from EIH are sharing the links in the chat now. Through these 2 frameworks, the Americas will work towards WHO's 3 billion targets, the foundation of WHO's 13 General Program of Work. And as you may also know, the measurement of these targets has been consciously aligned with those of the Sustainable Development Goals to reduce the country burden in data collection and streamline efforts to accelerate progress towards achieving key targets. As our director says, Paho's strategic plan sets out concrete health outcomes and impacts that will directly measure our progress in delivering health to our people, to work toward health equity, and to improve our capacity for measuring inequities. It sets the direction we need to pave and the alliance we need to forge along the way, such as with the collaborating centers, understanding that they multiply our capacity to develop and implement projects, innovate, and create new opportunities in learning, knowledge sharing, and innovation. To promote equity in health is Paho's first mission. Paho has strongly advocated for measuring, analyzing, and monitoring social inequalities in health. Strategically, health inequality monitoring is essential to create accountability on the promise to leave no one behind, which inspires the Agenda 2030 for Sustainable Development. As the Nobel laureate in Economics 2015, Angus Deaton highlights, average are no consolation to those who have been left behind. The strategic plan also identifies 8 key countries: Belize, Bolivia, Guatemala, Haiti, Honduras, Nicaragua, Paraguay, and Suriname, where the organization commits to dedicating more resources for technical cooperation to ensure that the health gaps are closed. Therefore, it is important that our collaborating centers can also support the organization to respond to the needs of technical collaboration in these countries. Lessons learned from past public health emergencies of international concern, such as the 2009 influenza pandemic and the Zika epidemic, had emphasized the need to improve preparedness for health emergencies and to strengthen surveillance, strategic elements that, without doubt, have been reinforced by the COVID-19 pandemic. We will learn more about this in today's panels. With this overview, I now invite our department directors to provide an overview of the priorities and key aspects being addressed in the region and the perspective of the work being requested by Paho in response to regional and global health needs, in accordance with our strategic plans and with a clear alignment and delivery by our collaborating centers. Let's start with James Fitzgerald, that is the Director of the Health System and Services Department. Please, James, you have the floor.
Thank you very much, Dr. Barbosa. It's a pleasure to be with you this morning. I'm going to share a few slides with you to really describe the overview of the work that we do here in the Department of Health Systems and Services. So if perhaps you could just confirm that you see the slides, I will proceed.
Yes.
Yes.
Thank you.
Very good. Excellent. Thanks. So yeah, my name is James Fitzgerald. I'm the Director of the Department of Health Systems and Services. We are one of the platforms within the organization that really strengthens access to comprehensive integrated health services and provides, I suppose, the architecture for the priority programs within countries to expand and to respond to their core objectives. The mission of our work is really built around the overarching objective of universal access to health and universal health coverage. This is where everyone should have access to comprehensive, integrated, quality healthcare services without incurring financial hardship. And this mission is really central to the SDG 3.8 and is core to many of the objectives in terms of that have been defined within the strategic plan of the organization. Some of the core areas that we work in is really strengthening health governance and financing, ensuring greater equity, increasing public financing in health, promoting the elimination of out-of-pocket payments at the point of services, and using some of the governance mechanisms to implement effective transformation of health systems through effective health policy and regulations. Primary healthcare is core to that strategy and the organization of people-centered, community-based, integrated quality health services through the approach on the development of health services networks. A number of inputs such as medicines and other health technologies are also a core area of our work. And as such, we strive to improve access and rational use of safe, effective and quality medicines and medical products, and of course, other health technologies. The health workforce is also a critical element of the health system. And so within the strategies and plans of actions that have been adopted by our governing bodies, we have core areas of work in really building and increasing the availability of the competent human resource for health that are culturally appropriated, well-regulated, well-distributed. Aligned with all of this is our strategies around health research and ethics in health research. And so these combined with some areas under the leadership and coordination of Dr. Garcia in information and evidence constitute some of the core pillars of the health system around which we deliver technical cooperation to our member states. I did want to mention two other important initiatives that we do run and support from the department. The first is the Paho Virtual Campus, and this is a virtual platform that really aims to build capacity for health workers throughout the region of the Americas in core areas of and core mandates of the organization, and in other areas where essentially the third level education is not responding to the needs. At present, we have actually 1.3 million registered users within the campus. And noting the remarks of the director and Dr. Barbosa around COVID, we have now currently 19 courses and over 680,000 participants that have taken the COVID-related courses. This is an extremely important area of our work because it allows us really to outreach into health systems and into the health services where healthcare delivery is being provided. The second important initiative that is supported by through the department is the Paho Strategic Fund, and this is a revolving pooled procurement mechanism, excuse me, for strategic public health supplies, essential medicines, other inputs that are required by the priority programs. Established in 2000, we now have 34 member states participating in the Strategic Fund and over 10 Social Security public health institutions. And the Strategic Fund is a very innovative mechanism built on the success of the Vaccine Revolving Fund. And it really, its purpose is to support the priority programs, ensuring access to quality essential medicines and other strategic public health inputs to achieve the objectives of our priority programs. Finally, a quick word on our work to support COVID-19 pandemic. The health systems action is critical to the response of the organization to COVID-19. There is a strategic plan, strategic preparedness and response plan that has been adopted across the organization. And within that, a number of core pillars directly speak to the work that is carried out through health systems, particularly in strengthening health service delivery networks for case management, the reorganization, the ensuring the adaptability of health services, a surging capacity in hospital care while obviously maintaining the delivery of essential health services, in particular at the primary care level. In addition, we work very closely with the emergency teams, supporting the emergency response in quality assurance and procurement of vaccines, PPEs, equipment, and diagnostics. And then, of course, supporting through a health systems approach the COVID-19 vaccination. So that's it, Dr. Barbosa. That's the overview from the Department of Health Systems and Services. Thank you very much.
Thank you, James. Very objective presentation. I think that you clearly stated the priorities that we have on this very important topic related to health system and services. Now I want to invite Anselm Hennis, that is the Director of Non-Communicable Diseases and Mental Health Department. Anselm, please, you have the floor.
Good morning, Dr. Barbosa. Good morning, all. Indeed, a pleasure to be here. Pleasure to be having an opportunity to meet some of the collaborators I've not yet met and to strengthen the relationship with those that we already have worked with. Now, the Department of Non-Communicable Diseases and Mental Health really consists of 3 units. The first unit is that of risk factors and nutrition. And the risk factors which it addresses includes tobacco control. And we've been able to make a fair bit of progress in the region over time to the point now that in spite of the pandemic, region of South America is actually free of tobacco smoke in public places. So the work never actually stopped. The countries remain engaged in terms of the strengthening and promoting environments which reduce the utilization of tobacco in public spaces. The second topic of risk factors and nutrition is a topic of nutrition, particularly malnutrition in all its forms. So on the one hand, it speaks to issues such as wasting, stunting, anemia, acute malnutrition, and micronutrient deficiencies. Now, many of these areas have become more critical during the time of COVID, which I'll touch on very shortly. But basically, the region of the Americas is probably one of the most disparate regions on the planet. So we have areas of excess and areas of deficiency. And certainly in terms of malnutrition in all its forms, there's still areas of the region in Central America, as well as in Haiti, where issues such as acute malnutrition remain challenges, particularly driven by the current pandemic that we face. We also have the other side of the coin with malnutrition, and that is the area of excess. In fact, of the 6 WHO regions, the region of the Americas actually has the highest rates of overweight and obesity in childhood, adolescence, as well as in adulthood, which actually ends up being a major driver for ill health in mid and late life. We also are the most sedentary of all the WHO regions. We have the highest prevalence of physical inactivity. Another topic in this area of risk factors and nutrition is the whole area of the economics of non-communicable diseases. And what does this mean? We recognize, for example, the importance of regulatory activities such as taxation, which reduces the consumption of tobacco. And this has also implications for the consumption of sugar-sweetened beverages and junk food. Additionally, the diversion of taxes towards health is another area which was developed in the Addis Ababa Agreement, an area where one may actually reduce consumption and actually have earmarked funds towards health. The area of non-communicable diseases, violence injury prevention, is also remit of this department. And the work is principally in terms of the topic of childhood cancers and cancers in women. And a flagship program of this unit is the elimination of cervical cancer. Cervical cancer is also linked to inequities and disparities, which is a common underlying thread and theme of the non-communicable diseases. And certainly in our region, issues such as screening, early detection, treatment, and of course, the human papillomavirus vaccine can actually lead to cervical cancer being the first non-communicable disease with the potential to be fully eliminated. Another topic of importance is the prevention and control of cardiovascular diseases, which are actually the major cause of ill health, disability, and death in our region. A program that we're working on is the program HEARTS, which has been scaled up in the Americas and the Caribbean on hypertension control and cardiovascular disease management, as well as including a theme in diabetes care. This unit also coordinates work on the prevention of interpersonal violence, violence against women and children, as well as road safety. And as you know, among the SDGs, it was supposed to be the reduction of road crashes by 50% by 2020. And this remains a major challenge for the region. Linked to all of this is the need for monitoring. And this is done through periodic STEP surveys, which is led by this team under the Pan American STEPS program. The third area of work is mental health and substance use. This unit has been working on strategies for mental health, neurological disorders such as epilepsy and substance use, as well as tackling harmful use of alcohol, in addition to disabilities and rehabilitation. As we know, non-communicable diseases account for 8 out of 10 deaths in the region. With the COVID-19 pandemic, the relevance of this topic has become even more urgent. In fact, we've seen an unprecedented interplay between non-communicable diseases and COVID-related outcomes, where existing non-communicable diseases worsen the severity of illness or increase the risk of COVID-19 related death. We've also seen previously unimagined health service disruptions, which are already having consequences on persons with entities as a result of the delayed care for such conditions. We also note the increasing reports of interpersonal violence, attempts being made by the private sector to roll back public health gains for tobacco, healthy eating and alcohol in particular, and the growing mental health crisis driven by the direct and indirect consequences of the pandemic. Some of the work which has been scaled up regarding mental health has been the further outreach in terms of mental health and psychosocial support to many countries during the pandemic, as well as working on mental health gap, where persons who are not specialists are trained in the provision of care at the primary healthcare level. We know that many countries have diverted resources away from these essential regarding in terms of favoring the pandemic response, and tremendous effort will be required to meet the SDG targets. So we very much look forward to scaling work with our collaborating centers and the deliberations of these 2 days. Thank you so much.
Thank you, Anselm. Non-communicable diseases, their risk factors and mental health are a very important priority for the organization, because now I think that the pandemic highlighted all the problems that we have about mental health, and also how the progress that we have made in the region, tackling the risk factors, but at the same time, the challenge that we still have to improve the response to them. So now we will move to Luis Andrés de Francisco Serpa, who is the director of the Family Health Promotion Life Course Department. Please, Andrés, you have the floor.
Muchas gracias, directora, directores, colegas, participantes. Antes de empezar, quería dar un anuncio de un mensaje de pésame por el fallecimiento del doctor Carlos Barceló. Él era director del Centro Colaborador para la Salud y la Vivienda en el Instituto Nacional de Higiene y Epidemiología y Microbiología de Cuba. Un sentido pésame. Quisiera saber si están viendo mi pantalla. ¿Sí?
That is coming. Yeah, okay, now we can.
Okay. Yeah, thank you very much. So I'm going to talk about the Department of Family Health Promotion and Life course. My name is Andres de Francisco. The strategic vision of the department is to empower persons, people, and their environment in order to build their health and to reach a good life and healthy life along the life course. I'm going to talk about the four main priorities of the department. The first one that goes on the program of immunization, to keep immunization as a priority for public health. In addition, despite and in addition to the immunization with COVID-19 vaccines that I'm going to mention in a minute. The second one, to look at the plan of action for the health of women, children, adolescents, which is basically an implementation of a regional platform following the global strategy for that topic. Third, on aging and what is required. And fourth, to talk about health promotion, social determinants, workers' health, urban, and community participation. With COVID-19 and well before COVID-19, vaccination has always been a very important intervention, as you well know. And in addition to that, it's fair to say that this region has actually had an amazing run in terms of increasing coverage and controlling diseases. In fact, many of these diseases that you see on this slide have been actually eliminated in the region: polio, measles, rubella, congenital rubella, and tetanus. There was a decrease of coverage on certain immunization vaccines, and in that sense, we got measles back. But having said that, the efforts of countries have actually been able to reduce the number of countries that have epidemic measles, only one country in the region at present. But the point, I think, is to say what the director was saying at the beginning. How can we actually keep the achievements? How can we keep what has been actually done? And in that sense, the COVID-19, the introduction of the COVID-19 has been a very difficult element in terms of the immunization programs. Because of the routine immunizations, programs have actually seen a major decrease in coverage, part at the beginning because there were no elements to vaccinate, and health services were adapting to the situation. But also part, people did not go to the services. So the idea now is to take the lessons that we have seen from countries to increase the coverage by putting specific procedures in case, like vaccinating in cars, vaccinating in banks for older persons of the population, and strengthening the epidemiological survey, and also making sure that the data quality of information is going to be up to date. Just to say that a strong immunization program is going to be key to the eventual sustained response of COVID-19, as well as other potential diseases that might come our way in terms of pandemic, because they have to be absorbed by the immunization program in order to be integrated in the response. The second point is the plan of action that I just mentioned. Earlier on, we were talking about reducing mortality exclusively of women, children, and adolescents. And now this is still a priority, but we are talking also about survive, thrive, and transform. And by thriving, we're talking about things like education, like early education, early stimulation of children, early breastfeeding, early immunization, and making sure that the families and the communities are involved within the development of children and adolescents, well beyond the equitable access to services that need to be adapted and appropriate for the different population groups along the life course, but also to say that COVID, for example, has been an important determinant in terms of the health services use. We do know that sexual reproductive health family planning services have been heavily affected by COVID-19, which is an area in which we are working to make sure that there will not be sustained stoppage of use of contraception, for example. And we also know in this region, and now it has been published in other regions over the weekend, that the COVID-19 does have a very strong, much stronger response and clinical repercussions in pregnant women that is already starting to make us look at what would be the way to actually control COVID-19. Would that be with vaccination of the currently existing COVID-19 vaccines, which is not yet being recommended, but we have to continue looking into this, as well as the health of their newborn. And then the information system, quality information system that we are working very closely with the Department of EIH, as you heard, in order to make sure that there will be information that can help governments to improve or to adapt the policies, public health policies, depending on the epidemiological situation in the countries. This region is aging at a higher pace than any other region in the world. And this is one of the reasons for which Paho countries with the Secretariat have been working in aligning the messages for healthy aging and being part of what has been launched in 2020 at the World Health Assembly, and also separately at the United Nations. That's the highest political level, if you want, of the decade of aging. And this is the decade of aging 2020 to 2030. It's basically a real worldwide movement to make sure that we do pay attention to aging populations. We look at long-term care, the involvement of the family, primary health care, and in particular, the involvement of the community, not only in the management of diseases, but also in the utilization and in the incorporation and reincorporation of older people within the communities. Also aligning the health systems and services with what is required and the needs of aging populations. And this is very important, in particular in COVID, as you well know, that a large percentage, particularly at the beginning, of deaths were occurring in this age group. So we are working basically with countries in ensuring that this is part of the primary healthcare and community-based interventions. And finally, the director mentioned determinants of health, health promotion. This is a thematic area that is very important to the department and certainly to the organization. This is basically promoting health and looking at decreasing inequities within society, looking at ways to identify and target vulnerable populations within their communities and utilizing intersectorial methods to do that. One of the important elements here, I think, is the incorporation, strong incorporation and participation of communities and on the social civil society to have those groups being part of the discussion and debate at the governance level. For example, there are some projects that are going on with urban health, in which communities are being part of the discussions and decisions on how to plan areas, urban areas and schools, among others, markets, which are foci of diseases in particular, as we have seen with COVID, but also make sure that those are places that are safe, places where people learn, study, or enjoy, in order to make sure that there's no transmission and that there is improvement of practices. And finally, the health of workers. which is an important area and topic in which there have been many well-known interventions to ensure that things like, for example, the building sites can be, in the time of COVID, can be safe for work with this thing. Thank you very much.
Thank you, Andres, to present the summary about all the very important points, immunization and many other points that are clearly a very important, very opportunities to strengthen the collaboration with the centers. Now we will have Marcos Espinal, the Director of Communicable Diseases and Environment Determinants of Health Department. I don't know if Marcos Espinal is here or someone on his behalf. Marcos, please. No, it's not Marcos. Marcos is replacing me in another activity. So we will have Luis Gerardo Castellanos that will present the priorities for the department. Please, Castellanos, you have the floor.
Thank you, Dr. Jarbas, and thank you, everyone. Particularly, I welcome you for the collaborating centers of Paho. Let me please try and share my screen, see if I can do that successfully. Can you please confirm if you are looking at my screen?
We are.
Is it in the right projection?
I think you should go into full presentation mode.
Hold on one second then. Still trying to do that. Can you see it now?
We can see, but I think that if you can put in the presentation mode, it will be better. Yes.
Okay. Now?
Yes, now we can see.
Okay. This is the first slide, and this is our first slide. I like to, on behalf of the Director's Department, Dr. Marcos Espinal, to offer you a welcoming to this meeting and present first the overall structure of this Department of Communicable Diseases and Environmental Determinants of Health, who is strategically and technically led by Dr. Espinal. And the department itself is composed by a management and coordination team, by a special program, by a decentralized center, the Pan American Foot and Mouth Disease Center, and 3 units. Each of these structures, specific units, special center, and decentralized establishment has a very specific specialty in terms of management, prevention, control, and elimination of infectious diseases. So to summarize, the whole mission of what we pursue within Paho is to collaborate with countries and work to advance the surveillance, prevention, control, and elimination and reduction when necessary of communicable diseases, zoonoses, and environmental threats to health in countries of the Americas. Our technical cooperation activities are guided by global and regional mandates, including the Sustainable Development Goals, the Paho Sustainable Health Agenda for the Americas, the Paho Strategic Plan 2020-2025, and the Paho Strategy for Universal Access to Health and Universal Health Coverage. And of course, multiple other global and regional policies, strategies, and plans of action, including the Paho's Disease Elimination Initiative, which rests on the following 4 principles, and I am summarizing it because it represents a corporate initiative that easily reflects the overall effort that our department is concentrating nowadays. Stepping up integration of health systems and service delivery, strengthening health surveillance and information systems, addressing the environmental and social determinants of health, and strengthening governance, stewardships, and finance. This corporate initiative easily reflects the overall effort the organization and the department is doing to enhance interprogrammatic collaboration. The Paho Elimination Initiative is a groundbreaking corporate policy to guide member states, countries, and territories of the region to step up effort to eliminate more than 30 communicable diseases, infections, and related conditions in line with the SDGs and aiming to leave no one behind. CDE department, has had collaborating centers play a crucial role in advancing the mandate of our department and providing needed technical expertise. As of March of this year, there are 37 active collaborating centers working across the region and linked to the mission and goals of our department. I'd like to offer you some simple examples into what some of these collaborating centers represent for our department. For Pathos, the Pan American Foot and Mouth Disease Center, the poxvirus and rabies branch Division of High Consequence Pathogens and Pathology at the National Center for Emerging and Zoonotic Infectious Diseases of the Centers for Disease Control of the US is the collaborating center for reference and research on rabies. It is a member of REDIPRA and also a member of the Regional Information System for Epidemiological Surveillance of Rabies. In antimicrobial resistance, I like to mention the Division of Infectious Diseases within the Department of Medicine at Brigham Young and Women's Hospital in the US, which is also a Paho WHO collaborating center for surveillance of antimicrobial resistance. Key activities have included for this center the development and update and adaptation of the WhoNet, a software for monitoring antimicrobial resistance worldwide. In our unit of HIV, hepatitis, tuberculosis, and sexually transmitted infections, I like to mention the Instituto Nacional de Enfermedades Respiratorias Emilio Coni from Argentina, which is a collaborating center for epidemiology and control of tuberculosis, instrumental for the past 3 years for the consolidation and analysis of the tuberculosis data of the Americas collected each year by WHO. In terms of our unit of climate change and environmental determinants of health, I like to mention the Vice Presidency of Reference and Environment Services of Fundação Oswaldo Cruz from Brazil. Fiocruz supported the development of a technical guidance document for surveillance of SARS-CoV-19 in wastewaters nowadays. Sorry. And for the neglected tropical and vector-borne diseases, I just want to easily mention 2 examples. One is Instituto de Medicina Tropical Pedro Curi de Cuba, who has contributed to the development of regional and national capacities for high-quality clinical management of patients with dengue throughout the Americas. And Laboratorio de Paludismo del Instituto de Diagnóstico y Referencia Epidemiológicos de México, INDRE, who has provided malaria microscopy training to assess the competency and quality of national reference laboratories for malaria diagnosis across the region. And I believe, Dr. Jarbas, with this, we are completing our description of mandates and mission of our department. Thank you for the opportunity.
Thank you, Castellanos, for this presentation with the priorities in this many important areas that we have a good collaboration with many collaborating centers in our region. Now we have Sebastian Garcia Saiso, who is the director of the Evidence and Intelligence for Action in Health Department. Sebastian, please, you have the floor.
Thank you, Dr. Barbosa. I'm going to start sharing now. Just a few slides. So I'm going to briefly talk about some of the areas that are coordinated by the Department of Evidence and Intelligence for Action in Health. Being this an area that works across the organization with all technical departments and provides also technical cooperation to our member states, using a lot of the work that is being developed by our collaborating centers, and of course, being grateful for all the support that we daily receive from them. So these are the three pillars, as the name indicate now, the pillar of evidence, a pillar of intelligence, and a pillar of action that allows to have a constant interaction and a way to integrate many of the things that happen around the use of data, information, and knowledge management, and how this is later used for the strengthening or the development of health policy and decision-making processes through knowledge translation. We support specialized searches and content finding in specific cases. And this has been highlighted by the COVID-19 pandemic and the fast response in terms of the need for evidence and the need for knowledge to make better decisions. We also coordinate the Pan American Journal for Public Health, about to turn 100 years next year. And we're very proud of our journal and what it represents for the region in terms of creating access for content developed in the Americas, but also disseminating very relevant and important content for our decision makers in countries of the region. Evidence is linked to intelligence as we generate health analysis that constitute the basis of this evidence using predictive modeling and having a direct impact on what is done in terms of measuring or monitoring equity and inequality in our region and throughout all of the health environment. Conducting also strategic networking, and here I have to highlight the coordination of all 183 collaborating centers that collaborate with our organization, and of course the interprogrammatic response and innovation that has led also now to launching a digital transformation initiative that includes the 8 principles based on the roadmap that was developed and launched a few months ago by the United Nations Secretary General. And in terms of action, then, we carry out direct technical cooperation with our member states through policy workshops, through conducting the maturity assessment and tools that have been developed in several areas, particularly the Information Systems for Health initiative, trying to measure the state that information systems in countries of the region have, and creating this or using this to create the roadmaps in terms of their strength. Having also possibility to offer training and information sharing. Infodemic management has been extremely important over the last few months as the infodemia that accompanies our pandemic. Big data analysis, and of course, the creation of repositories and virtual libraries that support the entire circle in between evidence, intelligence, and action on many of the topics that the organization develops. This, over the last few months, has meant also rapid response, creating not only specific products and adapting many of the different portals and repositories that have been already created, but allowing people, decision makers and general audience to have access to evidence and content specifically targeting particular needs. And this is the case of BIREME through the knowledge windows and of course the virtual health library, the creation of the COVID-19 guidance and latest research in the Americas through an evidence portal that makes this accessible for people around the world and particularly our region, and the creation, of course, of tools and documents that allow us to be closer to the needs and acknowledging some of the immediate requests from countries, for example, in this case, the use of telemedicine and how to implement rapid changes within the service provision in the context of the pandemic. This implies working very closely with countries, understanding what are their needs and what are the new areas that need to be acknowledged from a technical perspective, and of course working in an interprogrammatic manner to develop all these different elements in support of the general departments. And this allows us to have this constant interaction between levels of the organization with internal and external players and actors such as the collaborating centers, where as we propose this digital transformation, we have this possibility to link all of the different elements at the local level and of course at the regional level, creating policies, knowledge translation initiatives, data modeling, digital principles, and technical guidance that will feed into decision making the implementation of policies and research on this implementation, of course, data gathering, digital solution, and prioritization that will feed again into knowledge creation and knowledge application as we support informed decisions and create lessons learned that will support future developments as well. So with this, the department plays an important role in the integration of all these elements, and we're very happy to support and coordinate the work with collaborating centers. I'm very happy to be with you today. Thank you, Dr. Barbosa.
Thank you, Sebastian. Very objective presentation about the priorities and the topics and themes that the department is working on. We have 5 minutes to questions, and there is a question in the chat about there are some, not questions, but important comments. One highlighting the role of the virtual campus that James Fitzgerald presented in his presentation. There is one question about if I understand that if medical error or preventable patient safety incidents included in the strategic plan. In the US and Canada, medical errors are the third leading cause of death. I don't know if James can make a brief comment about this. James, please.
Yeah, thank you very much, Dr. Barbosa. So just a little bit more on the virtual campus. It was an initiative that was started in 2014 at the request of member states to really expand access to materials, educational materials for health workers where they are working. At that point in time, an analysis was carried out to determine if the academic institutions were really responding not just in areas of clinical management and biomedical studies, but also in public health aspects that are so important in terms of the capacity development of the health workforce. And that we identified a very important gap at that point in time. And as you can see, since 2014 and the growth of the virtual campus, we are responding quite well to that gap. We're also working very closely with the WHO Academy, which was launched last year. The WHO Academy will be building on key academic institutions also throughout the region of the Americas for the region. And the Paho Virtual Campus will be essentially the focal point for that. So we will be continuing to work and prioritize educational materials within the context of the mandates, but also in terms of clinical guidance that the organization produces, so that we can maintain health workers up to date in state-of-the-art knowledge that is required to deliver quality health services throughout the region. So thank you very much.
Thank you, James.
Doctor?
Yeah.
There were also a very interesting comment regarding the South-South cooperation, that it is also an important element for this region as a way to strengthen the cooperation with Portuguese-speaking countries as Cabo Verde, São Tomé e Príncipe, Guiné-Bissau, Portugal, Angola, Mozambique. Thank you, and also to highlight the importance and excellence of the work being done by Fiocruz on this regard as well. I don't know if you want to comment on this regard as well. Over to you.
No, thank you. I think that this is very important. I think Paho can be and has been a very important platform to facilitate the South-South cooperation. We have many good examples in the region. I think that Eliane mentioned one that the Portuguese-speaking countries have also. They are not in our region, many of them only Brazil, unfortunately. But Paho, working with AFRO, the regional office of WHO for the African region, has facilitated this kind of collaboration and also South-South cooperation among the countries in our region. So this is very important, so they can share the experience, the best practices, they can learn one from the others. And as their realities are more similar, this can be a very important kind of collaboration. I don't see any other questions or hand is raised, maybe because it's the first panel, so people are still warming up their engines. So I want to thank the directors for the presentation, the very good summary that they presented. I think that this will be important for the collaborating centers to review their priorities, to try to find the common grounds, to try to find the common interest areas that can enhance our collaboration and to allow Paho to continue receiving this very important support from the CCs in our region. Thank you very much. Over to you, Eliane. Bye-bye.
Thank you very much, Dr. Barbosa. Now we are leading to the second panel. Let me just share my screen very briefly so we can introduce our next panelists. Without further ado, I am inviting Ms. Marilu Valdez, our Deputy Director. She is going to moderate this panel, which is on regards to the regional perspective and beyond our strategies, the relevance of the collaborating centers towards the achievements of the SDG. Thank you very much, Ms. Valdez, to be here with us, and you have the floor. Thank you very much.
Thank you, Eliana, and good morning, everyone. It is truly a privilege to be with you here today in what is an incredibly important event. In the previous panel, Dr. Barbosa and our technical directors gave an overview of the priorities that drive Paho's technical cooperation. And these are at the center of what we do together with our collaborating centers. This panel will provide a deeper dive, so to speak, of Paho's strategies, plans, and mandates through an equity lens and consider our path toward the Sustainable Development Goals, SDGs, and some of the challenges we face in meeting the SDGs more broadly. Each collaborating center contributes to this shared agenda, providing Paho with expert advice and engagement in scientific and technical cooperation through research, capacity building, and technical support. Our collaborating centers help create a wide range of evidence-based synergy. And COVID-19 has certainly brought home the criticality of science and data for sound decisions and actions. Our panelists will provide a regional perspective on how Paho's strategic plan is linked to the main goals of the 2030 agenda. They'll touch on how Paho is monitoring the advances in the Americas, provide an analysis of the gaps, challenges, and opportunities to advance the SDGs, particularly Goal 3, which is ensuring healthy lives and promoting well-being at all ages. Working closely with member states, Paho and the collaborating centers must help to define the priorities and respond to health needs in what is now an ever-changing and rapidly evolving social, political, and economic context, while at the same time committing to leaving no one behind. This means integrating the elements of equity, gender, ethnicity, and human rights into the Strategic Plan 2020 and 2025. We need to determine the progress our region is making toward the SDGs. We need to analyze both the advances and the gaps in equity, human rights, ethnicity, and gender, as well as work to ensure our regional efforts align well with the broader global efforts as we monitor progress and provide technical cooperation. We certainly hope that the information shared by our expert panelists will enable our collaborating centers to be better positioned to identify future and further synergies and ways to support Paho through inclusion of the cross-cutting elements of gender, ethnicity, and human rights into their work plans. So to begin, I will invite Dr. Sebastian Garcia, Director of the Department of Evidence and Intelligence for Action in Health, to present on monitoring the achievement of the SDGs in the region of the Americas. Sebastian, over to you.
Thank you, Mrs. Valdez, and hello everyone again. I'm going to present briefly over the next minutes on SDG and health inequality monitoring as part of the Evidence and Intelligence for Action on SDG 3 targets, and allow me to begin by having some perspective on this. We've been working on monitoring SDGs over the last few years. We've been also very concerned about equity and social determinants as a way to understand our progress and also understand what are the elements behind this road ahead that we have in terms of facing the challenges and also taking the opportunities that we have. And let me quote Dr. Etienne in a publication back in 2015 when she said that what matters most for a healthy future is achieving social equity. We must not remain equity blind. And this is a very important, very powerful statement, implying that we cannot stay in a state where we don't see the difference and we don't see this different element affecting people differently. And this is key, as Dr. Etienne said, to ensure a better health, and we must address the social determinants that impede it. And how not to remain equity blind. And this in terms of how do we move in a way so that we don't leave anyone behind. We have to move from our average population health trends and something that we monitor and that we receive to also incorporating this social inequality in health trends and bringing these two elements together. Only in this way we will be able to know that we are improving health, we're moving towards better health, but we're also moving in this direction while leaving no one behind. So this is part of the strategic framework for generating accountability on the SDGs, our health agenda, the Sustainable Health Agenda for the Americas, and of course, the Strategic Plan 2020-2025 commitment to equity. And part of what we do in the monitoring of Paho Technical Cooperation in these terms as well. So health equity has been embedded in corporate mandates and planning instruments throughout many years, and of course, as a core function in our organizations. As it was stated in the first slide, this is part or the first of our missional objectives within the organization. This is reflected in everything that we do, and of course, should be reflected in everything that it's coordinated by this organization, including the work carried out by collaborating centers. Having the social determinants of health at the center of what we do, try to understand how these different interactions play a very important role to achieve health gains that are equitable. As we move then to our basic analytical layout, we have to understand how social hierarchy, and this is the population ranked by an equity stratifier, moves from the most socially disadvantaged to the least socially disadvantaged using quite equity stratifiers in this acronym PROGRESS, such as place of residence, race, ethnicity, occupation, gender, religion, education, socioeconomic status, and social capital, and interacts in our health dimension, how many we count, the proportion, the rate of what we're achieving. Here we have three different options. We can do quintile partition and see how a particular element is behaving in particular groups, like segments of this population. Regression lines that allow us to calculate the absolute gradient on how this distribution is happening, or concentration curves, where health inequality concentration index or the relative gradient is calculated and allows us to have then a perspective of what is happening in terms of equity and particularly health equity. So this is linked to our core health data initiative that has more than 25 years as an effort to disaggregate multidimensional data at national levels to allow us to monitor health inequalities. And this is something that we conduct with member states as part of our commitment, and of course that we support in order to have better information and better data based on stronger information systems for health that allow us to not only have also better analytical capability, but how to use this data and incorporate it to decision-making at the local level, at the national level, to tackle these inequities that are still prevalent. So, in the monitoring of health inequality through the 2030 and our Sustainable Health Agenda of the Americas, we incorporate the social determinants perspective to the life course perspective, using the health outcome dimension, but also the healthcare dimension, how these two elements come together so that we know how people are having health needs, and these are being met by the health systems, the provision of services, and how this then also feed into a health policy dimension through the development of the different indicators that provide insight into how we need to tackle from the understanding of these elements and provide solutions. So these are the objectives of the SDG 3 monitorings that we have at the Pan American Health Organization, where we move towards improving accountability with countries with increased capacity to do their own monitoring, and also providing information for a specific decision-making. We have the best available evidence provided and accessible for member states. And this includes a very important work in terms of the interprogrammatic at the organization, but also interagency work with exchange and collaboration with other United Nations agencies and academic institutions, where most of the work with our collaborating centers in this respect lies. So if we look at this, we have now prepared, with all the information available, a portal that allows us to have all the data and analysis together and the evidence available provided to member states as an easy way to track progress and also start finding all these different elements that act as barriers or challenges in a given moment. Just to go into some of these details, this is the dashboard that was created with this end, but I'm going to go over the next couple of minutes. So in some of these examples, particularly in some of the key indicators within the SDGs. So this is SDG 3.1.1, maternal mortality rate. We see, for example, how for the region of the Americas, we had up to 2019 a good progress towards our goal, and we see that the region itself, the value of the region, is lower than the value that was established as part of the global SDG target. So here, if we look at this and we see what this means, then we can say that we're currently underperforming, even though we were and we are still below the goal that was established. But if we see and we look at how the world is going to meet the target, we would then expect from every country to have an annual average rate of reduction of around 7.6%. Even if we look at the Sustainable Health Agenda of the Americas 2018-2030, the goal established for the region was set at 30 maternal deaths per 100,000 live births. So this would require countries in the Americas to have this reduction in the annual average rate of reduction of 4.6%. We are not close to this. Only 6 countries in our region are close to this number. And this is, of course, very important to know that this is all information pre-COVID-19. Latest information and projections tell us that we're probably going to have a setback in around 13 years in our maternal mortality rates in the region due to COVID-19. And this will imply the need for a great effort from everyone involved in order to keep us or re-get us into track. We need to identify the barriers. We need to know what is happening at the local level. We need to adopt a specific approach by subgroups of countries and understanding particularly the subnational level at this stage. We need to investigate, for example, the quality of postnatal care and identify and implement reduction accelerators in these particular contexts. Now, this is the average. So this is, again, an indicator that tells us the whole region. And of course, it changes a lot if we look at particular countries and difference in between countries. But if we look inside this indicator, we look at the equity within this indicator. This is the relative inequality gap. So we see that there are great differences in how we are achieving this. Going back to my first slides, in which we need to bring not only the progress in health, but also measurement of inequalities, or how we are obtaining this in terms of how these gains are distributed in population. We can see that for maternal mortality, in particular SDG 311, we have 7.9 more deaths, or 7.9 times more affection in the least, the more vulnerable populations. So as we move and as we gain this progress in our SDGs, we need to understand that if we don't take care of those that are most vulnerable, we will leave people behind, being part of the problem. If we look at neonatal mortality rate, then we see again a adequate performance. We see something that would say the region is moving in the right direction. We have a good overall performance, and we are in track to achieving the goal set for 2030. Well, once again, there's 2.8 more times of having a neonatal mortality in the most vulnerable groups, which again signify the huge gap still present in terms of equity, and the call for strengthening our efforts in order to make these gains available and accessible for all. The same, looking at NCDs, and this is SDG 3.4, looking at the unconditional probability of dying at age 30 to 70 from some NCDs causes, in particular cardiovascular disease, cancer, diabetes, or chronic respiratory disease, where we have a low performance in any case in terms of being, of course, having a decreasing rate, but still far from reaching our 2030 target. And the call to adopt, or the need to adopt, specific approaches by subgroups of countries, trying to tailor fit our policies, our approaches, and prioritize prevention, timely diagnosis, treatment, and management of NCDs within this particular context. Identifying barriers, and of course also the accelerators that will allow us to have a more successful implementation and effect from this. Dr. Hennis was mentioning this as an important component of what they're doing, understanding the different drivers within countries and even subnational level, and how we can accelerate this in the way forward. Again, the relative inequality gap is even going in the wrong direction. It's not only, as we had seen in the others, diminishing. In this case, it's still increasing, 1.48 times more unconditional probability of dying from NCDs in the most vulnerable or the less advantaged groups within society. So if we look now at communicable diseases, and this is just an example with SDG 3.3.2 in terms of tuberculosis incidence, we see that we have a rate in the right direction, but a very important low performance. We need to accelerate the annual reduction rate required. We need to accelerate the progress we make towards this SDG. We need to expand the use of the new rapid molecular diagnosis and reduce treatment regimens with patient-centered managements that allow us to better tackle health needs in our communities in terms of tuberculosis. And again, we have a relative inequality gap that shows that we're not achieving this with the necessary equity, with the necessary possibility to have this accessible for everyone. And of course, the call to change how we're doing, what we're doing, and it starts by understanding who are those that we're not seeing, who are those that we don't have still within our actions, without what we do, our plans and strategies, so that we can acknowledge that we need to do something different for them. With this, I finish, Ms. Valdez, and I thank you all for your understanding. I apologize for my dog and the noise around that distract me a little bit, but I thank you all for your attention.
Thank you.
I'm sorry, Mr. Valdez, if you don't mind, just a reminder for our attendees that you are welcome to place your comments and questions to our moderator and panelists from the Q&A. And we are running a little bit behind of time, so we appreciate the timing from our next panelist. Thank you very much. The floor is yours again, Mr. Valdez. Thank you.
Eleni, thank you. And thank you, Sebastian. Let me turn quickly now to Dr. Jerry Eichmann, Unit Chief of Health Promotion and Social Determinants, and Paho's regional focal point for the SDG Global Action Plan. Jerry will speak on some of the opportunities for action in the advancement of the SDGs in the Americas. Dr. Eichmann, over to you.
Thank you so much, Didi. Thank you, colleagues. Great to be here with all those centers from the region. Sharing my screen. Share. Let me see. Hope you can see my screen now, correct?
Perfectly. Thank you very much.
Great. So yes, I'm going to briefly speak about some opportunities that we're having in the region for action on the social determinants, of health, of course, but on advancing on the Sustainable Development Agenda, the Sustainable Development Goals in the Americas. We just heard it from Sebastian. Even before COVID, the progress that we were making on the SDGs was insufficient. When we were in the last UN General Assembly in 2019, the last presidential one, many heads of states, including those in this region, were saying we are not on track, we're not on track to meet the 2030 agenda. So of course, COVID has meant a huge setback for the SDGs, including the health-related SDGs. And I think it's very important that we have heard the data that are crucial to identify those gaps, to identify the action that is needed, to pinpoint where we need to focus in which populations, and to ensure that no one is left behind. And I really want to mention here that data are essential for our actions, but are not sufficient. We need to use the intelligence that was presented by Sebastian and by his team towards really making policies that address those inequities and that focus on what needs to change. So for that, Paho, the assistant director, has set up the SDG steering committee where we do periodically look at how we are doing on the SDGs and what do we need to do differently. Again, back to COVID. So of course, we've went through the phase of the direct COVID mobility and mortality. Then we've seen that COVID interrupted care for other urgent and chronic health conditions. It's still not back to normal. And we've seen now we're in this third phase where the longer term impact, including through health determinants, need to be addressed. Economic, social impacts, mental health, weakened services. So this is going to be our situation and our targets for the coming years. So in 2019, the World Health Organization launched the Global Action Plan for Healthy Lives and Well-Being for All. They launched it actively with all the heads of the agencies in October 2019 in New York. And this has a goal to enhance collaboration among 12 global organizations, now 13. I'm going to show you which they are, engaged in health, development, and humanitarian response to accelerate country progress on the health-related SDG targets. They're looking at aligning programmatic, financial, and operational policies, approaches, and methodologies to enhance efficiency, effectiveness, to accelerate, and there they identified what they call the accelerators. I'm going to speak a little bit more about them, and to really to enhance joint accountability for delivering collective results for people. I think it's not news for anybody that also within the UN, the alignment around SDG 3 and around health has not always been optimal. And this was really an effort to bring the different agencies on the same page, for strengthened support to national actors to drive the SDG acceleration and accelerated progress towards the health-related SDGs. So the initiative in first instance was launched by Gavi, the Global Finance Facility, the Global Fund, UNH, UNDP, UNFPA, UNICEF, UNAID, UN Women, the World Bank, World Food Bank, and of course the World Health Organization, who has been pushing this and has a secretarial function. And this then also replicates in all the regions. And I mentioned ILO last because they have just joined last month. This is growing, getting traction, getting more attention, has a lot of potential. But of course, everything is as good as it becomes on the ground. So this is one of the challenges we are seeing. So the accelerators that were collectively defined there were focusing on strengthening primary healthcare, sustainable financing for health, strengthen community and civil society engagement, focus on determinants of health. I always think that's a very poor image there because it looks like a health service. Then innovating programming in fragile and vulnerable settings and for disease outbreak responses, research, development and innovation and access, and digital data and digital health. So these are the 7 accelerators where all the agencies have grouped around. This all, of course, was in 2019, before COVID. So we looked with the Office of the Assistant Director, so what needs to happen now with this SDG gap, the Global Action Plan at regional level. So we said we need to adapt it. We have to make it operational in this region. We need to map out what's already happening, what the different partners are already doing in those different accelerator areas, and then develop a regional SDG gap work plan. We have to find a nice name. I'm thinking about SDG RAP from Regional Action Plan, with the social determinants of health, community participation, civil society engagement, research and development, innovation and access, and digital health as the accelerators of the progress towards the SDGs at the heart. These are some of the accelerators. There's others that are also very important, but we think these can really make that leap that we are needing now. So first mapping exercise was carried out. I'm not going to in the details. Once it's really finished, we will give you a full overview, but you see here that in many countries, and here you see in Spanish a slide, excuse me for that, a total of over 400 projects have been identified on those accelerators to from the different UN agencies. And this is very important for us to see where are we going to collaborate, where are the opportunities for working together and to be more effective, and where is the opportunities for Paho and for WHO to really let's say pick the low-hanging fruits when we move towards the SDGs and make the necessary relationships. So this is already my last slide, and I have here put some reflections on some questions. So the SDG gap was conceived and was launched before COVID. Many of our data also are before the COVID pandemic. And the global, regional, national and local realities are not the same. We know that. So the socioeconomic impact has been so huge. We've all talked about it. But for this region, just one single number here, I think this is so powerful. This pandemic has set us back in this region 14 years in the reduction of poverty. So for countries to refocus and to strengthen is not going to be the same as usual. As a business as usual will not cut it if we want to meet the SDGs, if we want to have health for all. But there are also opportunities, and we've all talked about them. But how will this COVID pandemic impact the role? And these are the questions for you for now, but also maybe for tomorrow to think a little bit about that. How will the COVID pandemic impact the role of the collaborating centers? And how can you all, and can we all provide support and support the action and acceleration needed to achieve the SDG 3? and beyond, of course. How can we overcome our traditional limits, our traditional silos, and work more in an integrated, interprogrammatic manner, also between centers with different disciplines, using the SDGs as our guiding agenda? How can we do that? And lastly, and this is, I think, a key question for all of us, those new opportunities that everybody talks about, this window of opportunity that we have that will not be with us forever. How are those new opportunities for Paho and for the WHO and Paho WHO Collaborating Center in this new reality? How can we adjust, and how can we make sure that this opportunity of creating a healthier, fairer, more equitable future for all will be a reality and not just a dream? And how can we make the SDGs leaving no one behind, given the very complex situation in which we are? I invite us all to keep thinking and to keep reflecting on that. And thank you so much for your attention. Thank you very much.
Thank you. Thank you, Jerry. Let me turn quickly now to Dr. Anna Coates, Chief of the Office of Equity, Gender, and Cultural Diversity, to present on the assessment of equity in health policy. Dr. Coates, over to you, please.
Thank you, Lou. And just let me try to share my screen. I hope that you are now seeing it, and I hope you are seeing the correct version.
Perfect. Thank you.
Thank you. Thank you very much. Thank you for this opportunity to present, and welcome to our collaborating centers. I'm the Chief of the Equity, Gender and Cultural Diversity Office, as just been said, and we are charged with the mainstreaming of these cross-cutting themes across Paho's work. We fall under our Deputy Director's office, and so really we have the role of providing leadership, monitoring, and enabling work on these themes across all Paho's work, and directly with member states to also support their mainstreaming across policy, programs, and plans. And my focus in this presentation is really going to follow up from these previous presentations in looking at how health policy at national levels currently reflects regional commitments to health equity. We've heard already from both Sebastian and Jerry about the realities of health inequities in the region of America, so I'm not going to repeat those. As we all know, health inequities have multiple causes, underlying social economic conditions, geographic barriers to basic health services, lack of equitable, culturally sensitive, and gender insensitive health services, and often poor relationships between providers and community members. And underlying many of these issues are often multiple different histories of structural discrimination that are played out in broader society, but also within the health system itself. And these inequities, as Jerry has just quite rightly said, are much more visible now than ever in the context of COVID. COVID did not create those inequities, but it has highlighted those and it has exacerbated those. And their existence really does demonstrate that health policy generally has largely failed to successfully tackle inequities in health, at least at the rate that's required for the real transformative change that's needed for the achievement of the SDGs. And again, these have already mentioned, but the urgency of addressing health inequity in the region is very well recognized, and it is reflected in this series of global and regional mandates at global level, as is the focus of this panel. There is the Sustainable Development Agenda, which has its overriding framework, the commitment to leave no one behind. And its goals are really indivisible in terms of recognizing the independence between the goals, hence the significance of the collaboration that Jerry was just mentioning. And for health equity, 3 goals are perhaps particularly significant. Goal 3, obviously, that we always talk about in terms of ensuring healthy lives and promoting well-being for all, but also others. Goal 10, reducing inequalities within and among countries, and also goals such as Goal 5, which is achieving gender equality and empowerment of all women and girls. So the Sustainable Health Agenda, which Sebastian also mentioned, the Sustainable Health Agenda for the Americas, is the principal strategic planning and policy framework built by countries of the Americas for public health within the framework of the SDGs. And that also has the goal of achieving the highest possible level of health with equity and well-being for all peoples. Member states of this region have also agreed and adopted a series of specific commitments and resolutions that support advances towards equity in health, and perhaps principal amongst these is the Strategy for Universal Access to Health and Universal Health Coverage, which was approved in 2014. But there are also others in specific areas of attention of fundamental relevance to equity, such as the Gender Equality Policy, which dates back to 2005, the Ethnicity and Health Policy from 2017, and also the Resolution on Health and Human Rights approved in 2010. Paho's strategic plan is really our guiding instrument in terms of technical cooperation, and our current strategic plan places equity at the heart of health and builds on the four cross-cutting themes: equity, gender, ethnicity, and human rights. And these are addressed throughout the organization's work to improve health outcomes and to reduce inequities in health. And these are the ones that fall directly under EDC and my office's remit. So all that to say that we have regional mandates that demonstrate a commitment to equity in health. But for those regional commitments to be transformative at national levels, they of course require national level commitments for action in alignment with those regional mandates. So we recently conducted a review of how health policies across the region currently address health equity. And this study takes as its starting point, or took as its starting point, health policy, recognizing the fundamental significance of public policy in terms of its central role in producing or reducing the institutional and structural drivers in inequity. Now, of course, whether or not those actions are taken and what impact they have is subject to further assessment. But even for those actions to happen, they do need to be included in policies and plans in the first place. So the goal of this was to represent how health policies across the region currently address health equity. The study was funded by the Robert Johnson Foundation and conducted with the O'Neill Institute, who I believe are connected today. And the full study is published as a report, as well as a peer-reviewed article in the Pan American Journal of Public Health. It involved a qualitative content analysis of publicly available documents using a 10-category, 38-indicator analytic rubric, and that was applied to 32 national health sector plans, which were current as of 2019. So yes, pre-COVID. The different categories touch on a variety of different aspects of health equity, from social and environmental determinants, participatory processes, identification of populations in situations of vulnerability, and a number of others. And the actions that the indicators encompass are not necessarily all those actions required for health equity, but they do reflect most of the key elements that are currently considered either in literature, in the various regional mandates, as well as what is already in policies themselves. And together, these were used to create the framework for analysis. And it's really an initial foray into classifying and analyzing health equity in policy. There will need to be further application to the rubric combined with other more in-depth analysis, and that hopefully will gain new insights and adjustments to the rubric. And there are, of course, always limitations to this kind of study for practical reasons. We were only able to analyze health plans and policies, and we took those as a starting point, given that they are the primary guiding instruments for public health. Policies and plans beyond the health sector and specific health sector interventions were excluded, but we do recognize their importance and the need for further study there. And also for reasons of comparability, health sector laws and other related legislation were not included, which meant that the US, Canada, and Cuba, unfortunately, were excluded because they don't have comparable national health plans. And of course, despite efforts to create a sound rubric, qualitative assessment and contextual analysis policies is always going to be inherently subjective, because there's a level of interpretation of meaning and intention involved in documentary analysis. So this analysis is by no means intended to be taken as a judgment call. All that said, the analysis does reveal how countries are currently approaching health equity and what actions they aim to operationalize. And the figure here shows the general overview of how different aspects are included to one degree or another across the region. And in general, across the region, there is a consistent inclusion of health equity as a mission or as a goal of health policy planning and implementation, and data disaggregation, which, as we've heard from Sebastian as well as from Jerry, is very important, is a stated aim to track and monitor inequalities. However, the inclusion of other aspects is rather more varied. So, for example, though there's a frequent mention of a focus on populations in situations of vulnerability, these are often quite narrowly defined. Most plans either don't name groups they consider to face greater barriers to access and poorer health outcomes, or they limit their identification to vulnerability to people living with certain disabilities or living in poverty, rather than looking at other groups and issues related to gender, ethnicity, and human rights. And there are also limited inclusion of actions related to the design and operationalization of accountability mechanisms to improve education on the right to health and to enforce rights, and of course, community participation in the design, monitoring, and evaluation of health policy and plans. And there are other interesting findings. I don't have time to mention them here, but for example, related to the varied inclusion of work and financing of work on the social determinants of health. Some of the key recommendations that come out of this initial study, therefore, follow on from these findings. So really, we do need much more standardization of methods for identifying groups and situations of vulnerability. And on the basis of that, evidence-based actions to reduce their barriers to health, satisfy unmet needs, and guarantee the right to health. And importantly, for our collaboration with collaborating centres, we need further research into the processes which produce health inequities for diverse groups, and which specific policies and actions work to reduce inequities in health access and outcomes for these groups. We need a redirection of budgets, of course, towards these evidence-based policies and programs, and we need much further efforts to educate on the existence and use of accountability mechanisms to address violations of the right to health, to address inequities in health. But perhaps the most, and I'll finish with this, perhaps the most main takeaway from this exercise is the need to increase diverse, inclusive, and community leadership and participation in intervention design, in monitoring and government accountability for health equity. And this would really help significantly in meeting the specific needs of groups and ensure greater accountability for leaving no one behind within the SD agenda. Now, this might be happening in practice, but it's generally not mandated as essential in policy documents. We're now working with the Robert Wood Johnson Foundation, who also funded this initial work as a partner to further this work, and community participation and leadership will be a central focus. As Paho collaborating centres, many of you represent, partner with, or serve communities, so we do hope very much that we can increase our partnership with you as we move forward in this work. Thank you very much indeed.
Thank you, Anna. Let me just point out that Dr. Pereira dos Santos has been incredibly efficient in questions and answers. So Eleni, I will defer to you and Sebastian, but I know we're running out of time and we're running late. So it may be good, I'm going to depend on you to get the answers for the pending questions, please. And I'm hoping everybody joins me in what was 3 very excellent presentations on the issues around the SDGs and equities. So thank you very much. Again, it was my pleasure to be here with you today, and back over to you, Eleni.
Thank you very much, our Deputy Director. Excellent interventions as well. We are honored to have you here with us today. It was excellent, as well as our panelists. Yes, it's true that we are running behind time. What I suggest, as we informed, we are keeping all questions, comments registered here. We are going to request our panelists to address those questions alongside the day so they can post their responses. And also we encourage our colleagues attending this event to do the same, regardless panel 1 or panel 2. You are welcome to post your interventions at any time, and we're going to address during the event or later on. With that said, I appreciate all of panelists and our moderator for the panel 2, as we are leaving for a very short break. Everyone deserves a break. I'm suggesting us to resume by 12:15, just a couple of minutes to stretch and to do what we have to do. So we can resume to the panel 3, which will be moderated by Dr. Godfrey Schrabb. Thank you so very much once again, and see you in at 12:15. Thank you very much.
I have to explain, because not everyone is in the Washington DC area and time zone. So let's meet here. Now it's 12:08. So it's in literally 7 minutes, please, everyone, regardless of the time zone you're at. Thank you very much. Creo que estamos, Eliani.
Dr. Shreb, my distinguished panelists. I'd like to confirm if Dr. Ciro Ugarte is here with us already. Okay, I see him here. Excellent, excellent. Dr. Shreb?
Hi, can you start my video, please? Because I cannot start.
Yes. We are gonna give you the... Can you now? Perfect.
Thank you.
Excellent.
So, good afternoon or good morning, colleagues. Thank you, Sebastian, for organizing this important meeting with our collaborating centers. And as panel 3, by the way, I'm Godfrey Schwirab, the director, the head of office of the country and sub-regional coordination within the Office of the Director of Paho. And today's panel 3 session is on partnerships. But the key is partnerships as a vehicle for the delivery of technical cooperation and Pan-Americanism. And I think that this is a key word that we need to think about in the context of this panel, Pan-Americanism. When you look up the definition of Pan-Americanism, it says that Pan-Americanism seeks to create, encourage, organize relationships, associations, and cooperations among states of the Americas through diplomatic, political, economical, and social means. So in the context of this definition, I think it's very important that the work that Paho does with its member states also reaches out to create, encourage, and organize relationships and associations with other third parties, in this case, our collaborating centers. And our two panelists today, Mr. Alberto Kleiman, who's the Director of External Relations and Partnerships and Resource Mobilization within Paho, and also Dr. Ciro Ugarte, the Director of Health Emergencies, will discuss two elements of this partnership. One is how we look at partnerships as an instrument of strengthening Pan-Americanism, especially in the context of South-South and triangular cooperation. And Paho has been in the forefront of this with its member states, encouraging Paho's Secretariat to look at cooperation among countries for health development, what we call CCHD. In this kind of relationship, there is no recipient and provider, but there are partners. It's a win-win, and we see the work of our collaborating centers as an important element of this South-South and triangular cooperation. And then, of course, there is a second type of collaboration, again, within the context of Pan-Americanism, which is the international solidarity during emergency situations. And here again, we see the fostering of relationships. We see the fostering of collaboration between countries. In this case, maybe it is a recipient and a provider, but in the interest of Pan-Americanism and solidarity in an emergency, we foster a relationship that is more of a fulfilling the SDGs, fulfilling the role of development, and fulfilling the role of building back better post post-disaster and post-emergency. So without any further ado, and also because we are running short of time, I would like to invite my colleague, Dr. Alberto Kleiman, the Director of External Relationship, Partnerships and Resource Mobilization, to talk about partnerships in the context of Paho and the Collaborating Center. Over to you, Alberto.
Gracias, Godfrey. Anuncio que voy a hablar en español, quebrando un poquito, rompiendo con la línea anglo que viene. Agradecer no solamente a mi colega Sebastián García, pero todo el equipo de EIH, Eliana y todos los colegas, y desear una buena tarde, o sea, un honor estar con ustedes acá. Voy a compartir mi pantalla en este momento y ustedes me indican si va bien, ¿no? Acá tengo... ¿Funciona?
Se você puder colocar no modo apresentação.
Estoy haciendo eso. ¿Mejor?
Ahora sí.
Bueno, nuevamente comentar que esto se ve la pantalla.
Sí, se ve tus comentarios también.
Bueno, entonces hay que cambiar esto.
Creo que fue lo que pasó conmigo en la mañana. Quizás ahí abajo, ¿tú tienes dos pantallas?
Sí, tengo dos pantallas. Quizás por eso.
Por esto, lo que me pasó también.
Un momento, entonces.
Alberto, if you go into presenting mode and then you have the option there to either have two screens or split, and then if you cancel that, it'll come into normal.
Let me come back. Say it again, Sebastian, what is the option here?
Si vas a share screen, y haces la presentación, le das clic en el presenting mode, and then you have some icons where you can say how you want it to show, whether presenter mode.
Okay,
or...
that's okay. That's okay. ¿Bien ahora?
No.
¿Hola?
No, no se ve.
¿No se ve?
No.
There.
Vemos tu pantalla, tu screen, all the screen. Yeah, perfect. Thank you.
Sí, bien, ahora.
Go ahead.
Muy bien. Bueno, entonces, retomando un poco, un placer estar con ustedes hoy, ¿no? A ver, es este encuentro tan esperado, ¿no? Que se planificó con mucho tiempo, la importancia de traer todos los centros colaboradores. O sea, yo acompañé lateralmente en momentos pasados y creo que es un logro importante de IH de poner este evento hoy, ¿no? Y realizarlo, que en sí mismo se puede considerar como un ejercicio de fortalecimiento de alianzas, ¿no? Hacia el panamericanismo, dada la importancia de los centros colaboradores, ¿no? Yo quiero empezar recuperando una historia que viví hace poco más de 6 años, poco antes de ingresar a OPS, cuando fui invitado para hacer esta presentación. Estaba para ingresar a OPS y el tema de la presentación era los ODS y oportunidades para OPS. Y yo empecé mi presentación con esta imagen, ¿no? Y yo ponía como un riesgo importante del futuro de OPS y de todas las organizaciones de mucha tradición y grandes organizaciones, de este ejercicio del niño que mira el propio ombligo, ¿no? O sea, el riesgo de uno mirarse a sí mismo, tenerse como referencia, como autorreferencia, sin mirar alrededor, ¿no? Y los ODS estaban en su momento en una etapa de intensas discusiones, y yo me acuerdo que las asambleas mundiales de la salud, había un movimiento muy fuerte para que el tema de cobertura universal de la salud fuera uno de el tema más importante de los ODS ahí, y incluso en los foros latinoamericanos o de OPS se hablaba que cobertura universal no era suficiente, habría que tener acceso universal también. Y esto, una discusión que pasó y les traigo porque parece que hace un siglo ya que vivimos eso. Se aprueba una resolución en 2016, si no me equivoco, de cobertura universal y acceso universal. Una vez más, la región de las Américas, digamos, avanzando en sus posturas, en sus iniciativas de mirada hacia la salud universal, ¿no? Y bueno, en este año 2015, y esta presentación que yo hacía fue un poco antes de la resolución en la Asamblea de Naciones Unidas que finalmente aprueba los Objetivos de Desarrollo Sostenible y que aprueban los 17. Y son definidos de una forma muy innovadora, muy digamos, diferente que mucha gente pensaba en este momento, y sabemos desde entonces cómo la importancia que tienen los Objetivos de Desarrollo Sostenible. Pero quizás una de las innovaciones más importantes fue justamente el Objetivo 17, ¿no? El Objetivo 17, para allá de los temas, de la discusión temática, súper importante y fundamental, que vamos a priorizar como humanidad en alcanzar en 2030, el Objetivo 17 traía justamente, ok, queremos cubrir todas estas 16 áreas, pero ¿cómo vamos a hacer? ¿Con qué medios? ¿Con quién? ¿Con qué modalidades? Y por la primera vez quizás en la discusión temática de desarrollo se suma una discusión sobre la forma de hacerla y los medios para hacerla. O sea, salir un poco de la discusión, o no salir, pero ir más allá de la discusión de qué queremos discutir, pero cómo debemos hacerlo, ¿no? Y es evidente que para el mundo de las alianzas es un marco importante el Objetivo 17, ¿no? ¿Con quién? ¿Con qué recursos? Y nos trae, digamos, un desafío de discutir estas cuestiones a nivel global. Y evidentemente trae la relevancia a las alianzas, a los partnerships, ¿no? Es un punto de inflexión, es un punto importante de que releva la discusión de alianzas a un nivel global, de importancia global. Esta es la imagen que refleja la situación de OPS hoy, diferente del niño que se mira el propio ombligo, pero más la idea de all heads on the deck, ¿no? De todos juntos por objetivos, ¿no? Es un hecho que el trabajo de OPS es siempre y sigue siendo ejecutado con socios, ¿no? Sería imposible pensar que no. Sería imposible pensar, mirando incluso el histórico de OPS, todo su trabajo ha sido puntuado, ha sido desarrollado con la colaboración en alianzas, ¿no? Y no solamente con los Estados miembros, ¿no? Que son los agentes centrales y principales, pero también con una variedad y tipos de alianzas, ¿no? En nuestros días, las alianzas dejan de ser algo lateral y puramente instrumental y pasan a ser un componente fundamental de la cooperación en sí mismo, ¿no? La capacidad de los actores, la sinergia creada y el tipo de alianza van a determinar seguramente el resultado mismo de nuestra acción como organización, ¿no? Un ejemplo que comentaba mi colega Godfrey es la cooperación sur-sur, ¿no? Hoy, coincidentemente, la SEGIP, la Secretaría Iberoamericana, lanza su relatorio de la cooperación sur-sur y triangular en Iberoamérica, ¿no? Curiosamente, estos relatorios que les invito a conocer, ¿no? Y conociendo el sitio a los que no conocen, hace un relevamiento importante, quizás único en la región de Iberoamérica, que es Latinoamérica más los socios europeos, de qué ha sido hecho, ¿no? OPS ha tenido la oportunidad de colaborar con este relatorio durante 2 años para justamente abordar cuál es el componente de salud de esta colaboración, de esta cooperación. Y independiente de este, digamos, suplemento de salud que hemos trabajado con SEGIP, el relatorio ya traía el hecho de que la cooperación sur-sur y triangular en Latinoamérica traen alrededor del 25% de proyectos en la área de salud. Es decir, los estados miembros, los gobiernos, los países de Latinoamérica y de las Américas, si quieren, prioricen en su intercambio sur-sur y triangular los temas de salud. O sea, hablar de cooperación sur-sur en Latinoamérica es efectivamente hablar de salud. Y bueno, entonces, ¿por qué hacemos alianzas? ¿No? Digamos, bajando un poco más a un momento más conceptual, pero de la perspectiva de OPS, ¿no? No que nosotros como organización, o ustedes como organizaciones importantes que son también, no pueden hacer solos, ¿no? No pueden desarrollar objetivos solos. Lo que pasa es que es mucho más eficiente, efectivo y rico que trabajemos en socios, ¿no? O sea, desarrollamos objetivos comunes, los ODS son unos, pero la Agenda de Salud Sostenible de las Américas y tantos otros, y esto nos ayuda a definir y actuar de forma más activa para atingir nuestros objetivos. Seguramente la importancia de movilizar recursos acá financieros, recursos técnicos, recursos de información, recursos políticos, que son importantes también, y finalmente generar innovación, ¿no? Innovación para investigación en salud, transferencia de tecnologías, mejoras en procesos, y un cuarto componente que se sumaría a eso todo y que yo añadí es el tema de la diversidad. Las alianzas que hacemos nos generan un elemento importante de valorización de la diversidad cultural, la diversidad de género, la diversidad institucional, la diversidad social. O sea, esos son los 4 elementos constitutivos de las alianzas que nortean nuestro trabajo, ¿no? Bueno, OPS coopera con básicamente estos 2 tipos de gubernamentales y no gubernamentales, actores básicamente organizaciones gubernamentales con quien colaboramos mucho, organizaciones no gubernamentales de países, acá hay un error, gubernamentales de países no miembros, ¿no? Organizaciones de Naciones Unidas e instituciones académicas de investigación, muchas veces gubernamentales. Pero seguramente las alianzas con los actores, los agentes no gubernamentales o agentes no estatales son de fundamental importancia. Acá estamos hablando del sector privado, ¿no? Entre empresas, organizaciones empresariales, fundaciones privadas, organizaciones de la sociedad civil, fundaciones filantrópicas e instituciones académicas no gubernamentales. Y acá es importante mencionar el FENSA, ¿no? El conocido FENSA, que es el marco de colaboración con agentes no estatales, que es aprobado en 2015 en la Asamblea Mundial de la Salud, que finalmente disciplina, es un marco legal, es el marco legal de OPS y de OMS. En OPS es aprobado en 2016, idénticamente como aprobado en OMS, para traer claridad y transparencia a este tipo de de alianza. ¿Y cuál es la importancia de FENSA? Es justamente dar a conocer qué tipo de alianza es posible, dar a conocer al público y a los socios efectivamente cómo OMS y OPS deben operar. Y el avance es justamente eso. A partir de este momento podemos hacer eso y no podemos hacer. Antes de eso había mucha confusión, había mucha duda y poca transparencia, sobre todo para el público general. FENSA avanza en este sentido, de ahí su importancia que todos ustedes deben conocer. Acá un poco una foto, una fotografía del tipo de alianzas que hacemos en OPS, que hicimos el bienio pasado, por número solamente de socios financieros que han contribuido financieramente con OPS. O sea, esto no representa el universo total, pero solamente una foto que pasó el bienio pasado. Pero es una foto interesante porque trae los números en porcentaje. O sea, el primer tipo de actor con quien nosotros establecemos relaciones son gubernamentales, ¿no? Países miembros, organizaciones y agencias gubernamentales. Y curiosamente, aún como contribuidores financieros están las instituciones académicas de investigación que también contribuyen con Paho, ¿no? Y después, organizaciones gubernamentales de países no miembros, agencias de Naciones Unidas, ONGs y finalmente instituciones financieras internacionales. Como yo decía, eso nos revela el perfil total, pero solamente de este año, pero nos da a entender un poco los desafíos de mejorar las relaciones, por ejemplo, con el sector privado, con organizaciones no gubernamentales. Y ahí estamos trabajando, ¿no? Un poco un otro instrumento que hemos creado en OPS es el portal de alianzas que ustedes pueden conocer, está justamente en el portal web de la organización, y ahí les comentaba que nos generaba en ERP, en mi departamento, un incómodo que no teníamos en nuestro portal, en nuestro sitio internet, un espacio donde podíamos compartir experiencias con nuestros aliados, ¿no? Hablábamos mucho de qué cosas importantes que hacíamos como organización, pero no que hacíamos juntos, ¿no? Dejar de hablar de mí y hablar de nosotros. Y les invito mucho a visitar, está en la página principal, si bajan un poco van a ver, y también como una posibilidad de entrada, o sea, cómo nos asociamos, por qué la OPS, y bueno, una empresa, una ONG, un actor interesado puede ir a la página, visitarla y conocer un poco más, incluso técnicamente, o sea, cómo establezco una alianza con OPS. Y también traemos las historias, la diversidad y los resultados, sobre todo los impactos que hemos generado en estas alianzas, ¿no? Quiero cerrar finalmente destacando 3 alianzas que me parecen importantes mencionar para pensar tanto en los logros, en los éxitos obtenidos en el pasado y los desafíos del futuro, ¿no? El primer caso que traigo es la eliminación del polio en las Américas. Les invito a visitar, hay un sitio muy especial que es como una visita a un museo de los logros alcanzados por los países de las Américas junto con OPS para la eliminación de polio en las Américas en 91 y la certificación en 94. Eso es una iniciativa que sigue hoy en día con otro tipo de alianza, el Polio Global Eradication Initiative, que sigue teniendo el apoyo de Rotary, que fue fundamental en las Américas, pero ahora con el apoyo de Bill y Melinda Gates, que también siguen colaborando, OMS, UNICEF y otros. Eso es un buen caso de éxito, ¿no? De avance de una tarea global, un desafío gigantesco que ha logrado un avance significativo de trascendencia efectivamente global. O sea, es un caso interesante para analizar. El segundo caso que me gustaría destacar es justamente los ODS, ¿no? Esta agenda de los Objetivos de Desarrollo Sostenible es un caso de éxito justamente porque movilizan la comunidad global en dirección al desarrollo. Ponen el desarrollo en la agenda central y hacen todos los tipos de alianza, no solamente en la salud, pero en todos los elementos que también definen y para los cuales la salud contribuye, ¿no? Si vamos a alcanzarlos, es un otro tema, va a depender de las alianzas, de las sinergias y de la fuerza de los socios involucrados, ¿no? Esperamos que sí y trabajamos para que eso ocurra, ¿no? Hasta 2030. Y finalmente, quiero cerrar con la alianza COVAX, que también es una alianza importante a nivel global con actores, agentes muy importantes, pero acaba de decir del desafío que estamos viviendo de la pandemia del COVID-19, como un desafío que va más allá de temas que discutimos hoy, incluso en el ámbito del COVAX. O sea, el COVAX ha avanzado. El doctor Barbosa siempre nos dice que en comparación con la pandemia de la influenza, el COVAX ha logrado ya entregar vacunas poco más de un año de la pandemia declarada como elemento internacional, como hecho internacional de emergencia internacional, perdón, por la OMS. O sea, eso es un avance, pero sabemos de los desafíos de COVAX y, digamos, de la comunidad internacional de entregar de forma equitativa. El doctor Tedros siempre destaca eso de la importancia de que los países puedan ser más solidarios e invertir. Y yo creo que el COVAX nos trae el desafío de pensar tanto en la pandemia del COVID-19 que vivimos actualmente, como el desafío de las Américas de pensar otras alianzas innovadoras para que los países de las Américas, sobre todo de Latinoamérica, puedan pensar en el futuro de mejorar su capacidad de producción y distribución de vacunas de forma más solidaria para que en pandemias futuras, que seguramente las tendremos, no ocurra lo que está ocurriendo hoy en día de la dependencia de estos países en la obtención de vacunas, ¿no? Y OPS seguramente estará aliado a eso y seguramente las Américas con sus países, sus actores, sus socios, como ya han probado, enfrentado desafíos importantes, seguramente podrán estar preparados para más este desafío. Así que termino. Muchas gracias y buenas tardes.
Thank you, Alberto, and thank you for that comprehensive overview of partnerships, and of course with the biggest, I think, new partnership, COVAX, which leads us quite nicely into the second part of this panel, where we talk about emergencies, and maybe for many collaborating centers, we have looked at emergencies more as hurricanes, volcanoes, and other natural disasters. But in the last year, I'm sure that we have all been focusing on emergencies in also a different perspective in our region, that is, because in other regions of the globe, we have looked at emergencies in a much broader perspective than I just mentioned. So to discuss this aspect and also how the collaborating centers can form an important part of our work in emergencies, I would like to invite the Director of Health Emergencies for the Paho region, Dr. Ciro Ugarte. Ciro, you have the floor.
Thank you, Godfrey. It is a great pleasure to be in this event. We have been working with many collaborating centers in several areas towards the action plans, the annual programs, etc. But beyond that, in a close partnership in preparedness and risk reduction to respond to large emergencies. And I would like to share a presentation on how we do this. I don't know if you can see it.
Yes, good.
Okay, excellent. So let's see if we can put in a presentation mode. Okay. Our areas of work in health emergencies are essentially these 6 areas of work: infectious hazards management, country health emergency preparedness and the international health regulations, health emergencies information and risk assessment, emergency operations, that is essentially response to emergencies, emergency core services that are related to the leadership, but also the planning, the budget, the human resources, etc., everything that there's managerial aspect. And the other one is disaster risk reduction and special projects. And I would like to go through Paho outcomes. And the first one would be health emergency preparedness and risk reduction to strengthen countries' capacities for all hazard health emergencies and disaster risk management for a disaster resilient health sector. I begin with this because this is essentially at least half of the work that we do in the health emergencies department. And our goal is to strengthen the country's capacity, not necessarily the secretariat's capacity. And through that, we have targeted outputs during this period, and you'll have this presentation, so I will not go in detail in these slides, but just for you to have the entire picture of how Paho is working in emergency preparedness and risk reduction. And in this regard, we are fully aligned with global initiatives like the Sendai Framework for Disaster Risk Reduction. In that regard, the Ministers of Health in the Americas approved a resolution on the Plan of Action for Disaster Risk Reduction 2016-2021, probably will be extended. There are 4 areas of work regarding the multi-hazard, ethnic, disability, and gender approach, and we do a risk assessment and capacity assessment using the preparedness index that was developed in the Americas and maybe used as a multi-sectoral tool, and also the state parties annual report for the international health regulations. And of course, we have the Health Emergency and Disaster Preparedness Index, that is a guideline that many countries are using to assess their capacity. But also how the health sector is doing their work, particularly in disaster risk management. And there are areas where the countries are reporting how they are doing, for example, on mass casualty management, on disaster hospital planning, and mental health, in supplies management, international assistance, etc., etc. And everything is done with the support of many partners. You can see there in this slide how many partners, for example, in the case of Mexico, we are working with on a, let's say, in a peacetime. And then we are moving towards resilient hospitals and health facilities. For us, the health sector and health systems and the health services, it is not just a philosophy or a goal to reach in, I don't know, in some time in the future. We look for actually changing the way health service, safe hospital, and systems in a way that they will be resilient. So we built on the Safe Hospitals Initiative that was established in the Americas in 2004, and the multi-hazard approach, surge capacity, smart hospitals, and then inclusive health facilities to include people with disabilities in the disaster management of the hospital. So, and what I'm showing you here, it is a reality. And there are many countries, even small countries, low developed countries, small island countries that are showing that this is feasible. Unfortunately, those hospitals that reach this level are continue operating even in harsher situations, and they are capable and able to surge capacity. And also national multi-hazard response framework. And there are many areas in this regard. And we are talking about the authorities at the multi-sectoral level, but also on the integrated and operational model response functions, but also recovery is part of this framework. And then we have the emergency medical teams. We look at this initiative towards inside the countries and not the international medical teams per se, and that is proving to be successful, particularly during COVID-19. And we work a lot on cross-cutting themes, including the disability inclusion in hospital disaster management, health disaster risk management with indigenous populations, and guidance on migrants and health. And of course, we are working a lot during peacetime, because during emergencies, it may be too late. And the second one is epidemic and pandemic prevention and control. So also, the country's capacities are strengthened to prevent and control epidemics and pandemics caused by high impact or high consequence pathogens. And these are the targeted outputs regarding research agendas, proving prevention strategies, and countries enabled to mitigate the risk of emergence or re-emergence high threat infectious pathogens. And this is the areas of work, particularly expert networks. We have many networks in that regard, and interventions for surveillance and response in all the areas that you see there. And there are specific areas of work that are permanent areas of work that you see to the right, left, that are the areas that build the capacity of the countries, but also from the regional perspective, so we can better respond to any emergency. And there is a network of public health laboratories on many areas of work, and you see there how many or which countries are participating in this laboratory network. This has been built through the years, and then we are able to advance in global and regional initiatives, and those regional and global initiatives, particularly related to pandemic influenza preparedness, had allowed us to implement a new process. And you see here the genomic surveillance network in the Americas that is composed by 23 laboratories with external sequencing, in-house sequencing capacity, and reference sequencing. So we are working here, particularly in this network, is Latin America and the Caribbean. And it is part of the current response to COVID-19. And then we work on health emergencies detection and response, rapid detection, assessment, and response to health emergencies. These are the outputs: potential health emergencies, rapidly detected, etc. And all those areas of work and targeted outputs are being transformed into detection, verification capacity, risk assessment, investigation and response, and also on reporting. And we have every year around 24,000 signals screened per year, 24,000 signals. How can we go to 5,000 initially analyzed and then potentially 160 potential events, 2 per week or 3 per week? So we have a continuous assessment of the situation, because the next large outbreak or emergency may happen during COVID-19. So we are also looking at the global outbreak alert and response with hundreds of partners, and we are working together to detect, but also to alert and respond rapidly with all the capacity that the network has. And everything is related, of course, with the country's capacities. And the country's capacities is continually being assessed, and we have monitored several areas of work of the countries, so we know where we are going to land if our regional team is being deployed. And in that regard, the regional response to COVID-19 is organized around 10 strategic pillars under the 2021 Strategic Preparedness and Response to the Pandemic. And these are the country level coordinating, planning, and monitoring. This is the area of multisectoral leadership, the risk communication, community engagement, and epidemics and management, the surveillance, outbreak investigation, and calibration of public health and social measures, points of entry in international travel and transport and population movement, national laboratory systems, including diagnostics and rollout, infection prevention and control, case management, including therapeutics rollout, operational support and logistics, maintaining and strengthening essential health services, with the health system coordinator, that is another initiative, and the vaccine readiness and rollout. So all these areas, we work a lot with many partners. Many of the WHO, Paho collaborating centers are providing essential support for us so we can implement actions in these pillars. But it is the cooperation is beyond that. We currently have around 100 partners that are providing funding to Paho. Some of them through WHO, many of them directly through Paho, and several of them also through Paho in the countries. So we are working in each of these pillars, trying to support all the countries according to their challenges. And as you know, the pandemic of COVID-19 will remain with us, unfortunately, until next year, until the vaccines are available, and we don't see that availability coming soon. And we have other emergencies. The volcano in St. Vincent, for example, the eruption of the volcano in St. Vincent is a situation that we were following from December, and even 2 months before the activity that was identified in the La Soufrière volcano in St. Vincent, we published in October 2020 as a supplement of our newsletter on disasters, and the contents of that newsletter was a partnership work that we did with many countries from the region. It was Mexico, from Japan, Indonesia, UK, and many other countries in the world, looking at the protection of the population from ashes, from volcanic ashes. And then all those initiatives and the research that was done during that process is serving a lot for COVID-19 response, because the use of the mask, the type of the mask, the filtration capacity, et cetera, done in social context. I mean, with epidemiology measures, but also in laboratory, showed us which masks are better, and that is being translated into COVID response. So with that, I would like to thank all the WHO collaborating centers for the excellent work that you do with Paho in peacetime and also during emergencies. Thank you so much.
Thank you, Ciro, and thank you for that comprehensive overview of the work that the Health Emergencies Department does, and the role of the collaborating centers also in this important work. Mm-hmm. I look to Ileana to see do we have any time for Q&A, or do we ask persons to send questions in the website?
Dr. Schreb, let me appreciate your intervention. Also, our distinguished panelists, as we are running very late today, we didn't want to cut anyone, because we understand that it was many years we didn't have the opportunity to see all our executive level management together and presenting the technical areas. We preferred to allow you to have enough time to go through that, and also allow other colleagues as yourself, Dr. Schreb, Alberto, that despite of not having collaborating centers under your department, that you could be seen and also share, and centers could understand the diversity and everyone working behind and very committed to the agenda, and as well as moving along with the collaborating centers cooperation. Due to the time, we are taking notes of every single comment and questions. We do have a couple of questions to Dr. Ugarte regarding emergencies, and also to Mr. Kleiman regarding Alliance. We are going to make those questions, go through them, and we are going to post the questions as to document the webinar as well as afterwards for the final report for this meeting. So I appreciate your understanding. We don't want to keep everybody more than time, as we'd like to wrap up the presentation. Just confirm to me if you can see my screen now, so we can move to the final part of the event, which is the wrap up. I believe that we learned a lot. There's a lot to digest and to incorporate in our agenda, to incorporate in the work plan. We know that many collaborating centers are in process to be redesignated, to discuss with responsible officers what is going to be the next 4 years. So take this opportunity to understand, to see what is beyond your work plan at this moment, and to see what can be done for the synergies and to strengthen even more this cooperation. I would like to open the floor to my colleague Sandra Weinger, who will very, very briefly explain the dynamics for tomorrow, as we have a more dynamic and open interaction with our collaborating centers. Go ahead, Sandra, please. You have the floor.
Thank you very much, Eliane. I am Sandy Weinger. I've had the pleasure of meeting many of you collaborating center directors and staff in my role as the regional focal point for CCs, for collaborating centers. So I am now going to explain the dynamics for day 2, and I'm going to refer to my notes just to make sure that everything is clearly explained. We have created 8 concurrent breakout sessions tomorrow, according to different technical topics, to number 1, give CCs an opportunity to learn more about each Paho technical area in a more in-depth manner, and 2, to give both CCs and Paho staff the chance to interact and dialogue with each other. The different technical topics can be found on the online agenda for day 2. To jumpstart the discussion and dialogue within each breakout session, we've also developed a set of guiding questions, which we will share with you today, so you can start gathering your thoughts and ideas. There's no need to send anything in advance. Just take a look and start thinking. As you registered for day 2, we have been pre-assigning you to a specific breakout session in line with your affiliation with a CC or a technical topic. Up to this point, nothing has changed. However, in an effort to provide simultaneous translation during these sessions, which we were not able to previously, we have had to make a slight change to the logistics. This afternoon, we will send you an email with information on the pre-assignment and provide a new link to the breakout session you have been pre-assigned to. Please use this new link to join your breakout session tomorrow morning at 10 a.m. So you will go directly to your breakout session tomorrow at 10 a.m. Each breakout session will last from 10 to 12, 2 hours, but some may not need the full 2 hours. There will be a break for lunch at 12 until 2 p.m. And we ask that you please join us at 2 p.m. using the link you originally received when you registered for day 2. And this will lead you all back here. All of this information will be clearly indicated in the email that you will receive this afternoon. So I think that is for day 2. And I also want to let you know about the posters. We're very excited about the poster exhibition. It is open now. It is open for voting now. Please visit our poster exhibition found on our site and vote either through Slido or by using the QR code that's provided on our site for the one poster you like the best. And all we ask is that you please try to not vote for your own poster. And we will see you all tomorrow. Thank you very much. Over to you, Eliane.
Thank you very much, Sandy. Very well. We are providing you all information that you're gonna need. Please vote. As we mentioned, we received very nice posters from 43 collaborating centers. They are very diverse, very formative. Visit, enjoy your colleagues as a way also to give voice, to give visibility to the centers. And the information, the QR code are as well here posted. So visit and enjoy and give us this opportunity as well to recognize the work being done. I see you tomorrow. Once again, thank you very much for all our moderators, panelists, participants. We just had more than 300 participants in this meeting. We are very, very glad with the results. We hope that it was instructive and informative for all of you, and see you tomorrow for the second day of the webinar. Thank you very much for everyone, and also for our interpreters who are stay here with us with this delay. Very much appreciated. Muchas gracias, muito obrigada. Até amanhã.